Scotch broom originates from Europe. It was brought to North America as an ornamental garden plant in the 1800s. It also had other uses, including as a coffee alternative, medicinal uses, and as a source of yellow dye. Since then, it's managed to escape from many gardens, and it's a common invader on both the Pacific and Atlantic coasts. There's two subspecies which differ mainly in their growth habit. These are the common broom and the prostrate broom. Some traditional uses: the blossoms were used for making an ointment to treat gout. Dodons recommended a decoction of the tops in dropsy. Culpeper considered the decoction of the broom to be good not only for dropsy, but also for black jaundice, gout, sciatica, and various pains of the hips and joints. A tablespoon of the powdered seed was taken in a glass of peppermint water for liver complaints. A decoction of broom was recommended in herbal medicine for benefits to gallbladder and kidney afflictions. Broom is a bitter narcotic herb, and it reduces the respiration and regulates heart action. It acts on the electrical conductivity of the heart, slowing and regulating the transmission of the impulses. The young tips of the flowering shoots are a cardiotonic. They're cathartic, diuretic, emetic, and vasoconstrictor. The plant is used internally in the treatment of heart complaints, and it's especially useful in conjunction with Convallaria majalis. The plant is also a strong diuretic, stimulating urine production and thus countering fluid retention. It causes the muscles of the uterus to contract. It's been used to prevent blood loss after childbirth. It was also used as a remedy for treating an irregular and fast heartbeat. The herb slows down and controls the transmission of the nerve impulses in the cardiac muscle. It helps to stimulate the production of urine and counters fluid retention. Together with lily of the valley, the broom herb was used internally for treating problems related to the heart. It was applied to the skin for sore muscles, pockets of infections or abscesses, and swelling. It was also used in hair rinses to lighten and brighten the hair. It's not clear what dose of the Scotch broom was safe and effective for any medical condition, so it should only be used under the supervision of a professional. A juice has been made by pressing the bruised, fresh tops and adding 1/3 volume of alcohol, allowing it to sit for 7 days, followed by filtration, and this was taken daily as needed. As a tea, 1 to 2 grams or 1 level teaspoon of the herb was steeped in 150 to 200 milliliters of boiling water, and then strained after 5 to 10 minutes, and this was taken as a cupful up to 3 times per day as needed. The tender tops of the plants have been used to flavour beer. The leaves and the aged flowers were smoked to produce a euphoria. The roasted seeds were served as a substitute for coffee. The flower buds were picked and used as a substitute for capers. The flower buds were also included in salads. It should be avoided during pregnancy and breastfeeding. Excessive use can cause nausea and diarrhea. Using the herb in large doses can upset the stomach. The herb should not be prescribed for patients with high blood pressure, kidney disorders, spleen disorders, or liver problems. The seeds of the Scotch broom are toxic for humans and for livestock. To learn more about herbs, supplements, and natural treatment plans, check out my website.